So the Gilbert Center for Social and Support Services have, of course, like so many other not-for-profits in Simcoe and Muskoka for that matter, we've been closed since March the 14th. All staff except for our harm reduction teams. These are 2 teams of 2, and they go out every day. They usually go between 5 Points and Mulcaster and Collier and Dunlop. That is where many people who are injection drug users or where homeless people are found during the day and evening, but we only go out during the day. And they also do needle sweeps. In fact, just recently on March 24th, when we were out, we picked up over 200 needles in the downtown area. And we also give out food product. We hang around the bus depot. We have food supplies. We give out, as I said earlier, unused supplies for crack kits, naloxone kits, water. We give out safer sex products, lube, condoms, things that are not going to be found that easily any longer. Sexual health clinics are closed in the county, and it's a lot of pharmacies. You just can't access those kinds of products anymore easily. So they go out. They're keeping social distancing. They have gloves. They have masks, but they don't have PPEs, personal protective equipment. That's hard to get. Even hospitals are having a hard time getting that. But they are working as close proximity as they can to make sure that folks get the products that they need. Most people are donating practical things like food. Some people are donating their time to make kits, safe injection kits from their homes, and then we pick it up. We leave the products at their doorstep, and then we pick it up when they're done. And that can be we can do online tutorials on how to put the kits together. So we do have like our youth group is continuing. Our 2S LGBTQ plus youth group is continuing for groups that normally would meet with us in Alliston, Midland, Orillia, and in Bradford. And there's a server link, and I can give you who to text to get the server link to connect to the online groups that are running through the Gilbert Center. Because a lot of youth are not out. Those that identify within the 2S LGBTQ plus are not out to their parents or friends, so we're very cognizant of that when we're doing anything that is taking place over the like the Zoom or FaceTime, WhatsApp, those Instagram, those kinds of things. Well, we've always been cognizant of the fact that sometimes we can't get a hold of clients for one reason or another. And we've always looked for alternate ways of getting a hold of clients. For example, some clients that don't have internet access, how do we contact them if they're in a rural setting? Like, how do we get a hold of them? How do we maintain confidentiality, which of course is a very big piece of the work that we do, because we work in an environment where people are testing positive, for example, for HIV, or they're within the LGBT community and they want to keep that part of their life anonymous. We also work with trans folks that aren't necessarily out. So we're more and more reliant on Facebook, which has been a great help to us because many people don't have internet, can get access into public libraries, but now the libraries are closed. So it's challenging. And if somebody wants to drop off food at our door, or we can go to if they have food products they want to give to the center and let us know where, we can go and pick it up, leave it at your doorstep, and we can pick it up. We will be looking at making crack kits, safe injection kits, probably next week, because our supplies fortunately just came in today. So there's that possibility. So there are things, if anyone's interested, they can text me and I can put them in touch with the right people at the Gilbert Center.